that bill. Welcome.
Looks like I'm up first. Mr. Chairman, members of the committee, I'm Julie Dine with the Virginia Hospital and Healthcare Association. And let me first thank all of the patrons. Sincere appreciation to Senator Barker, Senator Edwards, Senator Hanger, and Senator Donovan for your efforts. This is a complicated issue, and we are thankful for the conversation. Today, like many of you, and many of you in this room, Virginians are struggling and fighting with the flu, runny noses, and painful coughs and irritating sneezing fits. Countless of Virginians who do not have access to health care find their only option to be the hospital emergency room. Since 2012, uncompensated care costs for Virginia hospitals have exceeded $1 billion a year. In 2016, Virginia hospitals had a total of $1.1 billion in uncompensated care. Increasing health care access is essential to responding to Virginians' everyday run-of-the-mill runny noses, to more serious of those health challenges such as behavioral health needs, the opioid epidemic, and chronic diseases. According to the U.S. Substance Abuse and Healthcare Services Administration, nearly 35% of the uninsured population with income below $16,643 had a mental illness or substance abuse disorder between 2010 and 2014. Making Medicaid available to individuals with income less than $16,643 a year, and let me repeat that and let me underscore, $16,643 a year is the income. For a family of three, the income eligibility is $28,180. This provides an affordable coverage option for those Virginians who are currently lacking any support to improve access to care, to confront and manage chronic conditions that are preventing economic opportunity and driving up health care costs. Increasing access to health care coverage can prevent family illness or health problems from turning into bankruptcy, loss of home, and or poverty. Accessing available funds will offset current state spending for prisoner care, community mental health services, and the GAP program. The net result in providing more comprehensive services to far more Virginians while freeing up $138 million in state resources. In closing, a majority of Virginians do support drawing down federal dollars to help the uninsured access health care. Increasing access to health care is a common sense approach that will improve health, support 15,000 new jobs throughout the Commonwealth, and help preserve Virginia's community hospitals and healthcare centers that so many of us depend on. Amending the state plan for Medicaid assistance is the simplest, most direct way to provide eligibility for adults and the opportunity to access health care.
Great. Thanks for coming. Welcome. Look forward to hearing from you. And just know that if you have written comments, you can give them. The 20 minutes is a pretty hard number, but if you want to submit your written comments, we'll take those as well. Thank you. Welcome.
Hi, my name is Donna Sywinski, and I'm a resident of Fauquier County. And it's the first time I've testified, so I'm a little nervous. But our son, Adam, is almost 30 years old. He was born without the right valve of his heart. And our insurance has taken care of him until he was 26. He can only work part-time. His twice yearly costs are $4,000 per visit. He has to be on Eliquis, which keeps him from having a pulmonary thrombosis or a stroke. And that costs $500 a month without insurance. And at this point in time, he doesn't make enough money to qualify. So if we don't have Medicaid expansion, what that means is my husband and I, who are ready to retire, are going to have to basically bankrupt ourselves to make sure that he can get medical care. We've worked hard all our lives, and our son is very important to us. So I thank you, and I ask you to please listen and please expand Medicaid for all.
Thank you for coming today. It's very kind of you to travel to us. Thank you. Yeah. Yes, sir. Welcome. Yes, sir.
Russell Javone with AARP Virginia, and we support this legislation.
Thank you for coming today. Yes, ma'am.
Mr. Chairman, my name is Lorraine Bratton, and I'm a volunteer with AARP and from Roanoke County. A lot of our members are over 50. They're not eligible for Medicare, and they're losing their jobs. And they can't get insurance. So Medicaid is a survival thing for a lot of our members, and we have 1.5 million members in Virginia. Thank you.
Thank you for coming from Roanoke County. Yes, welcome.
Good morning, Mr. Chairman, members of the committee. I'm Jill Hankin from the Virginia Poverty Law Center. I'm here on behalf of the Poverty Law Center, but also the Healthcare for All Virginians Coalition. We have over 111 organizations in Virginia who've come together over the past several years to support Medicaid expansion in Virginia. It's time now for Virginia to move forward to provide health insurance to nearly 400,000 low-income Virginians. It's time for us to bring the money back from Washington, D.C. to help us provide this coverage. It's time for us to provide Medicaid to hardworking parents. In Northern Virginia right now, if a family of 3 is earning more than $11,000 per year, the parents are ineligible for Medicaid. Under expansion, again, I'll repeat that, $11,000 a year for a family of 3. The parents are ineligible. If we expanded Medicaid, that same family, the parents could get coverage if the family income was up to $28,000 a year. Still not much, but much better than $11,000 a year. And for a single individual, someone who has 0 income right now, who's not disabled or elderly, can't get Medicaid at all, no matter how poor they are. And this would move the income level up to $16,643 a year. Still very poor individuals who don't have any other access to health care. It's time for the state to really take steps through Medicaid expansion to address Virginia's concerns about mental health and the opioid crisis. I really appreciate the patrons' work on this issue. Senator Hanger's been a leader in on this topic, and there are approaches available to us to finally get treatment to people who need it. So I hope that these bills will move forward to finance and we could continue these conversations during the rest of the session.
Great.
Thank you very
Grateful you're
much.
coming today. There's about 12 minutes left for those of you that are in favor of the bill. Welcome. Yes, ma'am. Thanks for coming today.
Good morning, Senators. My name is Monica Hutchinson, and I live in Henrico County. I am here today to support the Medicaid expansion bills because I am the mother of a 10-year-old autistic child. Right now in Virginia, I have insurance through my job as well. My commercial insurance does not take care of treatment and things of that nature for autism. That is covered under Medicaid. But unfortunately, because of the income restrictions, we don't qualify for Medicaid like other families can. Medicaid also helps pay for special education here in Virginia, helps to make sure that our teachers are properly trained, make sure that the schools have everything that they need for each child to succeed. And unfortunately, special education is inadequately funded, and we know that. Burdens do have to fall back onto local school districts, and and not all school districts are equal in that respect. So, like I said, I am the best voice and advocate for my child, and I'm here fighting for my child today to make sure that he's given every opportunity, just like every other child. I know some children may need more resources and more support services than others, but every child is worth it. So today, I really do ask that you guys truly take a look at this, expand Medicaid here in Virginia to make sure that all of our kids are given the same opportunity across the board.
Great.
Thank you.
Thanks for coming today. Yes, ma'am. Welcome.
Good morning. My name is Jewel Farley. I'm here to ask you to support Medicaid expansion. We come talk to you about this for several years now. Medicaid expansion will help provide health care to 400,000 hardworking, low-income families. Medicaid expansion will also bring income back to Virginia. It is time to grow Virginia's economy again. It is time to have our tax dollars come back to Virginia once again. It is time to make sure that 400,000 Virginians have Medicaid expansion. Thank you.
Thank you for coming today. Yes, sir. Welcome.
My name is Charles Carter. I'm a two-tour Vietnam veteran. Since January the 1st of 2014, the state of Virginia has done between $2 million to $5 million a day to other states that have Medicaid expansion. Why are we waiting and wasting Virginia's money that people here in this state needs medicine? The elderly, you have families that's working 2 jobs that cannot afford it. You know, they cannot afford to take care of their children. But we put it in the hands of this committee to vote on what is right. We're not asking you to do anything that you would not demand yourself to be done for you and your family. Please find it in your heart to do it for the families of the people of Virginia. Bring Medicaid expansion to Virginia.
Okay. Thank you. Thank you for your service. Yes, ma'am. Welcome.
Hi, I'm Jessica Monenokaicho, and I'm going to be reading my friend's testimony. My name is Alexander Dixon with the Virginia Latina Advocacy Network, and I have lived in Virginia since I was 4. I am originally from Bogota, Colombia. I was born in 1982 with a disability called spina bifida. My parents and I came to the States because children with spina bifida were surviving in the States, which they were not in Colombia. During my childhood, my parents were able to afford and keep private health insurance that kept me alive. When I turned 18, I qualified for Medicaid, but it was hard to qualify and it was a long process. I was only on Medicaid for 3 years while I finished college. After college, I have been gainfully employed. The investment made in me while I was on Medicaid in college was worth it because it helped me become an independent adult. One of the jobs I had was as an ACA navigator in Maryland. I have seen firsthand the good that came from Medicaid expansion. Put simply, it is life-saving. I saw it save the life of a woman who, after she qualified for Medicaid, she went and got a mammogram. The mammogram found cancer and it was aggressive. Because she had Medicaid, she was able to get the treatment she needed to stay alive. I remember the woman with brain cancer because Medicaid expansion helped her. Access to medical care should not be dependent on where someone lives. As a Unitarian Universalist, I affirm that every life has inherent worth and dignity. Access to quality medical care is a human right. It makes financial sense and it makes moral sense. Therefore, I urge the committee to vote to expand Medicaid in Virginia. Thank you.
Thank you for coming today. If you do have some long statements you may want to, and they're written, you may want to give them here. Just make sure everyone gets to speak. Welcome.
Yes, good morning, Mr. Chairman, members of the committee. Robin Gann with the American Heart Association, and we, of course, are in support of all opportunities to increase health care access for Virginians. Thank you.
Thank you for coming today. Yes, ma'am. Welcome.
Good morning, Mr. Chair and members of the committee. My name is Julia Newton, and as a mother of a child that has severe autism, I cannot tell you in this short of time the hardship that having Medicaid expansion in Virginia, the hardship it has on families like me. So I'm here today to ask you to support Medicaid expansion for mothers like me and for children like my son. There was a time that I worked 3 jobs and I could not afford to go to the doctor, so I resorted in going to the emergency room, which it racked up a lot of bills. It also was hardship on my credit, and it's just a really hardship on the family to not have Medicaid expansion in Virginia. Thank you for your time.
Well, thank you for coming today. Yes, welcome.
Hi, you all look lovely. Mr. Chairman, members of the committee, my name is Brian Walsh, and I am here on behalf of the Virginia Interfaith Center for Public Policy, the oldest and largest interfaith organization in the Commonwealth, so most appropriately, blessings upon you. I am here today to say that the center stands in favor of expansion and drawing down those federal dollars, as well as getting coverage to those nearly 400,000 Virginians. Thank you.
Thanks for coming today. Yes, ma'am.
Mr. Chair and committee members, Jennifer Allen with Planned Parenthood Advocates of Virginia. On behalf of the thousands and thousands of low-income people that we serve across the Commonwealth who need not only reproductive health care but access to primary care too, we strongly urge you to pursue expanding Medicaid, and thank you for your time to hearing it today.
Yes, ma'am. Thank you for coming. Yes, ma'am. Welcome.
Thank you. Mr. Chairman, members of the committee, Felicia Preissner with the Virginia Catholic Conference. We support any measures that close the gap and expand Medicaid expansion. At its core, health care is for all, not a commodity within reach of some, but out of reach of others. Thank you.
Right. Yes, welcome.
Welcome. Mr. Chairman, members of the committee, my name is Stephanie Lynch. I proudly represent our Medicaid managed care plans, and we feel confident we are poised to increase access to coverage in whichever way the Commonwealth sees fit, and we look forward to continuing the conversation with you and your members. Thank you.
Great. Thank you for coming. Yes, sir. Welcome back.
Mr. Chairman, Scott Price, Alliance for Progressive Virginia. Wanted to let you know that when we poll our membership, expanding Medicaid is one of the most important topics, and it's something that matters very, very much in Virginia, and it's something we need to get done this year. Thank you.
Scott, thanks for coming. Yes, ma'am. Welcome.
Good morning, Mr. Chairman, members of the committee. I'm Dr. Karen Ruby, and I'm a pediatric cardiologist who cares for children and young adults with congenital and acquired heart disease. I also have the privilege of serving as the chair of the Board of Medical Assistance Services. Our board has repeatedly sent letters to members of the General Assembly supporting Medicaid expansion in the Commonwealth, and I'm delighted to have our team of Medicaid leaders here and just encourage you to support Medicaid on behalf of all the citizens in the Commonwealth.
Great. Well, thank you very much, Doctor. Appreciate you coming. Yes, ma'am.
Good morning, and I won't take the 3 minutes and 58 seconds. Mr. Chair, members of the committee, Heidi Lawyer with the Virginia Board for People with Disabilities. We support Medicaid expansion and deeply appreciate the tireless efforts of all of the patrons who have worked on this.
Great. Thank you for coming. Yes, ma'am.
Hi, Chairman, committee members. I'm Jenny Halborn. I'm with the Disability Law Center of Virginia, Virginia's Protection and Advocacy Agency for Individuals with Disabilities. We wanted to thank you for your work on this, and we support the bills for Medicaid expansion.
Well, thank you so much. Anyone else here to speak in favor of the bill?